Well, gender-based violence within the post-schooling education and training sector remains a serious challenge. 1 in 3 South Africans before the age of 21 report experiencing sexual violence. Despite some improvements in responding to incidents of GBV, more must be done to address patriarchy, gender socialization and equality, economic factors that lead to transactional nature of many relationships and other drivers of GBV in order to prevent their occurrence in the first place. Now, to address this, a collaborative forum convened by Higher Health and various other departments. Let's discuss this further. We're now joined via Zoom by Professor Ramneek Ahluwalia, the CEO of Higher Health. Prof, thank you so much for your time this afternoon. Now, I mean, the stats that 1 in 3 South Africans before the age of 21 report experiencing sexual violence is a crisis, in my view. Is the policy framework on GBV that was introduced, in fact, by the Department of Higher Education in 2020 not working? I mean, how do you think it should address this crisis?
I think the policy is actually written to address this crisis, actually, in reality. And Nati, greetings to you and good afternoon to everyone. It is a very difficult pandemic. Higher education remains a microcosm of a bigger societal issue. And to tackle this GBV or GBVF, which is gender-based violence and femicide, the only way we can do it is through a multi-sectoral approach. It's such a difficult pandemic, not like COVID-19 where we can have a vaccine. It's so embedded into our society. So the only solution is to find to the root causes. And I think that's why we're trying to build a huge partnership with South African Police Service. We're trying to build a huge partnership with National Prosecuting Authority, because as many protocols we are developing or minimum standards we are developing, at the end, this challenge needs a multi-sectoral, conjointed effort in order to tackle such a pandemic. And I think it is brutal. It's a crime. For me, there is no shortcut to a language of this kind when it comes to a terminology of this pandemic. It's a fatal pandemic. And to overcome such pandemic, we have to put a deeper policy implementation. And that's why the consultations with multi-government departments, trying to come up with joint protocols, putting some campus safety and security audits, putting a perspective like staff-student relationships, because we know that these are challenges, addressing gender equality, addressing situations with gender diversity in our institutions. So I think it needs to go to the cause and then tackle each and every cause. Then the problem of GBV can be only overcome.
And I mean, you are speaking something that a lot of, I think, professionals have said time and time again, essentially that, post-school sectors are a microcosm of, the bigger society. Therefore, those issues that you're raising should then be tackled. But we are just seeing that happen, year in, year out in terms of talking. So what then needs to happen? I mean, if we look at, for instance, the 26 universities that you speak of in your statement, the 50 TVET colleges, the 9 CET colleges, if we can use that as an example to the larger society in addressing it, shouldn't that be the first place that we start? I mean, that previous clip of a 19-year-old girl being beaten by a fourth-year student in a way in which she can't now come out of her dormitory to go to class.
So I think, Nati, just to answer you, breaking the silence is critical. And I think that's where our prevention methodology will go into deeper. And of course, the care and support to those who are affected. And we know there are millions of our young women who are infected with this epidemic of gender-based violence. In fact, that's the right word to say. In 2 years since the policy has been launched, we have put a co-curriculum on gender-based violence. Education is empowerment. There's nothing shorter than education. Putting it as a co-curriculum, embedding into the next generation of graduates coming out of our institutions, starting from the foundation phases when they enter our institutions and putting them into a peer-to-peer dialogues on gender-based violence and interactive curriculum is critical. We saw about 200,000 young students just last year enrolling themselves into this. And for the first time, where we only had, say, 200 people coming out and reporting GBV, we had over 6,000 young people voicing out about gender-based violence, which means that silence is being broken. Majority of them are not cases of rape on campuses. These are partner violences. These are violences that happen in their life through their uncles, through their families, through neighbors, through their own partners, and something that is experienced by our majority of our women, predominantly on daily basis. And I think the aim is early interventions. We can save Nosikelos in Fort Hare University if we could have intervened early from a toxic relationship. So engaging toxic mentality, bringing more men onto the picture. And I think these are efforts that have to be and continue. It's a brutal pandemic. It's not going to be solved in one day, but a conjointed, long journey of fight, something which is very from our inheritance, from our generations embedded into our society. It needs to be handled very, very appropriate. Like it will take time. That's what I want to see, Unati.
It is encouraging, Prof, that you are saying these engagements are happening and that you've seen a large number of students finally starting to come forward and speak about these issues. And of course, patriarchy, gender socialization and equality also being some of the things that need to be addressed. Do institutions know what to do with such information once they get a report? I mean, I would imagine once students start to open up, they want to see some form of action from the university, from the South African Police Services, from the legal framework. I mean, for them to continue then to come out and actually feel that this is being addressed.
So as we launch the policy, we have now broken the policy into some clean, simple protocols. So the first big protocol was what to do if there's a case of sexual violence on campus. The implementing guideline, which means step by step, the institution needs to follow in order to protect a human life that has claimed to be sexually violated on the campus or has been sexually violated on the campus. And that needs to be that is what we're trying to put in place. The journey of the survivor on the campus, removing the stigma away, protecting our whistleblowers, helping establishing of what we call it comfort rooms, not even safe rooms, but comfort rooms, psychosocial assistance, tying up with the South African police and the MP or the Tutuzela care centers. How do we take the survivor to them and how we escort them, role of campus security, private security in our institutions, not only from the prevention or patrolling perspective, but documenting of the evidence, complainant register, and then tying up with the National Register of the National Prosecuting Authority. These are multiple steps that each and every of the institution has to develop. Besides developing disciplinary tribunals, which are non-biased, non-management biased and supportive, and along with the responsible office that should be put in place. So this is a long journey, requires deeper interventions, buy-in from leadership, buy-in from student governing bodies, buy-in from academics and senates. And through your medium, we keep on appealing to our institutions, to our sector, to our parents, to continuously mobilize, put students into reality of what is happening around and be parcel of the solution making here.
Prof, thank you so much for your time this afternoon. Really do appreciate it. Of course, illuminating, just this serious scourge that we have in our society. Professor Ramneek Ahluwalia, there, the CEO of Higher Health.